Hello and welcome to Healthy Kingston. My name is Janet Wade. We have a busy program today. There's a lot going on in the town. We'll be discussing benefits for veterans that are offered through the Veterans Bureau here, the Veterans Program at the Town Hall. Particularly being at Memorial Day weekend, we certainly want to commend our veterans and certainly thank them for their service and let them know the benefits that are available to them if in fact they don't know them already. Then I want to introduce Kira Fernandes, who's the Program Director of the Kennedy-Donovan Center here in Kingston, and they serve families and children with different issues that she's going to be discussing a little bit further. So we want to give a shout out to them and make sure that everybody is familiar with the services they have to provide right here in our own town. And then lastly, I'll be introducing our health agent, Dr. Marcia Hertzberg, who will be informing us about the new mask rules that have come down through the Massachusetts Department of Public Health and how they're going to be implemented in the town, as well as an exciting new clinic that will be starting next week in the town, offering Pfizer vaccine to the schools, the staff, the school children, as well as people in the community who yet are unvaccinated and may work hours that aren't convenient for them to get the vaccine. So she'll be telling us the hours, but they're late in the afternoon into the evening and also on the weekends. So a lot of good information coming up. First and foremost, I want to tell you about our veterans program here in Kingston. And it is run by Priscilla Brackett, who's the administrative assistant. And she's very accessible. And my understanding is through Dennis Randall and Bill Caval, who are on the Board of Health, that she is a tremendous asset to veterans here in the town and is more than likely been in contact with everyone. But there are two sources of benefits and services available to eligible veterans in Massachusetts. The first, which is familiar to all veterans, is known as VA benefits. And the second source is a state-sponsored program which provides needy eligible veterans and their dependents with financial and/or medical assistance. The primary mission and responsibility of the local veterans agent, Priscilla Brackett, is to advise and assist resident veterans and their dependents in availing themselves of these federal and state benefits for which they may be eligible, and also perform varied duties in dispersing and administrating the state veterans services programs of financial and/or medical benefits. The eligibility criteria for state and federal benefits varies according to source and the type of benefit that you need. Inquiries pertaining to eligibility should first be directed to our local agent, again, Priscilla Brackett, who is at 781-585-0515, or you can email her at pbrackett, B-R-A-C-K-E-T-T, at Kingston Town Hall. Inquiries pertaining to eligibility, as I mentioned, are directed to her, or she'll refer the matter to a more knowledgeable source. Inquiries are recommended and encouraged, and personal appointments are also available. So please do keep in mind that we want to support you here in Kingston and through the state and through federal benefits, and make sure that you're receiving the services that you are more than deserving. Also, if you are a veteran and you've been impacted by the economic downfall caused by COVID-19, you may be eligible for financial assistance through the State Department of Veterans Services Chapter 15 Financial Assistance Program. And again, please reach out to the office here in Kingston and they will determine your eligibility and the type of benefits for which you qualify. So again, thank you for your service. Happy Memorial Day. And we're here to support you to our best ability. All right, next I would like to introduce Kira Fernandes, who, as I mentioned earlier, is the Program Director of the Kennedy-Donovan Center here in Kingston. There are many outlets to it and chapters of it on the South Shore, which she can allude to when she's talking about it. But we're very fortunate to have a center right here and easily accessible. So with that in mind, Kira, welcome. It's very nice to have you. So for many of us, we're not familiar with the Kennedy-Donovan Center. So could you please give us an overview as to what your mission is and the services that you provide?
Sure, of course. Thanks for having me here today. I'm glad to be here. I'm actually the director of the Healthy Families programs for the Kennedy-Donovan Center. So we're located in Kingston. We have a Healthy Families program there, as well as one in New Bedford. But the Kennedy-Donovan Center is a nonprofit organization, and we have locations from Milford all the way down to the Cape. So we're a human services organization. We work with families, especially children that have developmental delays through our early intervention programs. We work with adults that have intellectual disabilities. We work with families that are involved with DCF through our foster care programs. So we have a whole range of individual and family services around this part of the state. In our Kingston location, we have both an early intervention program and we have my program, which is Healthy Families. So I'll talk a little bit about what each of those programs are. The early intervention program is a program for children that are birthed to age 3 that either have a developmental delay or are at risk for a developmental delay. So our program there has a whole team of clinicians that are occupational therapists, speech therapists, nurses, social workers, developmental specialists and teachers who work with kids that have fallen behind in some way or have a diagnosed condition at birth. There are other eligibility criteria for that program. So sometimes families can be eligible for services if they're involved with DCF, and there's other risk factors. If the mom is younger, lower education level, and things like that can also make families eligible. So that program has clinicians that go out into the home and work with the child and the family to help them be where they need to be at developmentally.
Let me ask you, do you work at all with the public schools?
With
IEPs or any of that?
Yes, the early intervention program goes until age 3. So for families that still need services after age 3, the early intervention coordinator will help to transition them over to the public school system if they still need things.
Okay. And how, I mean, can one, if you have a concern about your child, what is the mechanism to get to your program? Can I just call and say, I have a diagnosis on my child through the pediatrician or through a psychologist, or do you have to go through more steps to get to access your resources?
For early intervention, anybody can refer just by calling our main number, which is 508-747-2012. And that's for early intervention. Anyone can call. It can be a daycare teacher, a parent, a pediatrician, a social worker. Anyone can call, and the front desk staff can help determine whether there's eligibility automatically, which could be based on a diagnosis, or if we need to do an assessment to determine if there's a delay and that there's eligibility that way.
Okay. How is this funded?
I'll talk a little bit about Healthy Families as well, but
Okay.
Early intervention is funded through the State Department of Public Health.
Okay.
So early intervention bills health insurance, but there's never a charge to families. So if their insurance doesn't cover it, it's funded by the Department of Public Health.
That is tremendous. That is wonderful. So young families don't have to be concerned that this is something that they can't afford.
Exactly. So any family is eligible for early intervention if they meet the criteria. Healthy Families, the program, and I previously worked for early intervention. So the program that I direct currently is Healthy Families program, which is also a statewide program. And our locations are in the Kingston office and in our New Bedford office. So Healthy Families is for young parents specifically. So in Kingston, we serve families that are ages 20 and under, and it has to be their first child. So they can come into our program during their pregnancy, or we can accept them during the first year of their baby's life. And we work with moms and dads. And so once they're in our program, they're able to stay in until their first child turns 3 years old. So for some of our participants, we can work with them for up to about 3.5 years if they come into us during their pregnancy. So, yeah.
Hi, do you work with the school, again, with the schools at all in that regard? If there are
Well,
pregnant students or?
if there are pregnant students, sometimes we do get referrals from the school districts if they have a pregnant student. Yep.
Can you tell us, you know, I'm thinking I know a young woman who's pregnant and I want to offer your services to her. What would you and her partner say? What kind of services specifically do you offer?
So for healthy families, we offer a really broad range of services and resources. Healthy Families is really designed to be a comprehensive program that looks at the parent's health, the child's health, their relationship health. So when they come into us, oftentimes they're pregnant. So we help them make sure that they have prenatal care. We talk with them about what to expect during the pregnancy. We help kind of guide them through that whole process, developing a birth plan, thinking about what labor and delivery will be like. We can see them weekly during that time, and then we usually see them weekly as well once their baby is born. So we're working on a whole range of things, again, taking care of a newborn baby, what that will be like, what to expect from a newborn, feeding a newborn, sleep, and what that will be like when you have a newborn baby, how bringing home a newborn impacts your relationship. We help our families either go back to work or back to school, or we help them get benefits like cash assistance or WIC if they need help with those kinds of things. We talk with them about what their goals are. Like, what was your family like growing up? What do you want to do as a parent raising your child now? So we help them kind of have that forward vision, designing their own goals, and we support them through whatever they want to work on. We do developmental screenings with the children as well. So any of the kids that are coming through our program, we're doing what's called an ages and stages questionnaire, an ASQ, to make sure that they're where they need to be developmentally. So oftentimes we do refer and work together with early intervention, which is nice because they're right in our building.
Right, exactly. That's wonderful. Do you work with Mass Health, local pediatricians? Do they come into the picture?
As far as referrals to the program?
Well, referrals, or if there are any health concerns during the pregnancy.
Yep, we do work in conjunction with the doctor's offices. During our regular program, not COVID, we're able to transport our participants to prenatal appointments if they need help with that, or bring them and their babies to a pediatrician's appointment. Our family support advocate, that's our home visitor position. They can be there with their young parent at the doctor's office to help them if they have questions or if they're not understanding what's going on. They can help to kind of support them through that too.
That is tremendous. And obviously you have access to a wide array of resources, because obviously young parents need support.
Right.
Yeah, and need to know where to go. So again, stipulating this is young adults 20 and under.
20 and under,
dealing with the pregnancy.
having their first child.
Okay. Wow, what a service. Gee, can you extend it to I wish something like this was available when I was having children.
Yeah, so also the Healthy Families is funded through the state, through the Children's Trust, which is a state agency that's really designed to prevent child abuse and neglect. So we have a really strong emphasis in our program on promoting positive parent-child interaction. So just promoting bonding and attachment with the baby and the parents when baby's first born, giving them developmentally appropriate activities that they can do with their child, things that are fun and interesting, how to put your baby down and do tummy time as they're getting bigger, like safety around your home. We do outside visits at parks, bringing them out to the playground, meeting other young parents. In the South Shore area, there's not a lot of young parents. So we like to do groups and connect them with each other. It's really a great program and very comprehensive.
It does. It sounds absolutely tremendous. So if you have any takeaways you want people to remember from your remarks, what would they be?
I would say if you're not sure whether you're eligible or not for Healthy Families, just give us a call. And the referral number for Healthy Families is 781-831-6960. We are based in Kingston, but we cover 16 towns and cities around this area. So we go all the way up the South Shore, as far north as like Scituate, Cohasset, and Hull, down through Marshfield, Pembroke, Kingston and Plymouth over to Carver, up to Rockland. We're a pretty big catchment area. So if you're unsure whether you might be eligible or not, just give us a call. And if you're not, we can always help you find other resources in the area too.
Tremendous. Well, thank you so much. I mean, this is a wonderful resource for young families, and I really appreciate your time, and I hope people hear this and take advantage of it.
Of course. Thank you so much, Janet.
Next, I'd like to welcome Dr. Marcia Hertzberg, who is the health agent for the town of Kingston, and she has a lot of interesting and exciting news about our progress with the pandemic. So welcome. Marcia, and could you please tell us what are the percentage of people that have been vaccinated in the town?
Yes, hello Janet, a pleasure to be with you as always. We have very exciting news in Kingston. We have got over 65% of the people in this town with at least one dose of their vaccine. We exceed the state's 50% vaccination rate. So our residents have been doing a tremendous job of going out there and getting vaccinated. And I would like to thank our senior citizens for leading the way and setting the example. Our seniors who are 60, in their 60s and 70s, have been over 90% of them have been vaccinated, and our seniors 80s and older are 100% vaccinated.
Wow.
Yes, so they've
That's
done a
wonderful.
tremendous job, right?
Wonderful.
And what's exciting is we've just opened up the vaccine to our 12 to 19-year-olds, and we've got close to 25% of that group that's been vaccinated, which is wonderful. We still are looking to improve with our 20 to 50-year-olds, and I believe that the news that I'm about to share with you will help make that easier for them.
Terrific. Please share.
So we were chosen by the Department of Public Health to open up a regional vaccine clinic in the Kingston collection. And on June 15th, we will be opening up our Kingston Plymouth Regional Vaccine Clinic at the Kingston collection. We're happy to announce that we have already got vaccine. We have the Pfizer, so that we will be able to vaccinate those 12 and older. And we are going to be opening hours during the week from 4 to 8 on Tuesdays, Wednesdays, and Thursdays to start, so that we can help those who are working, who wish to be vaccinated after work, and to help to vaccinate children after school and after school activities, and also on the weekend, so that we can try to make the vaccine more available for the time frames that work for the people in the community that have not been able to get out and get vaccinated because clinics haven't necessarily worked for them.
That's wonderful. Is this a walk-in clinic?
So we are going to be using one of the systems that are offered by the state, which is a system for being able to do online booking. And it is going to be available on the state website and as well as on our website.
And we'll put it on this, and it'll be in Healthy Kingston clipboard. Right.
That is correct. And we're going to share it with all of our neighbors. This is a regional clinic, and so it's open to everybody. And it is also going to take walk-ins as well. So if you're not sure about your availability and you're not sure that you can commit to coming in on a specific day, but all of a sudden you find that you do have availability, please feel free to walk on in, bring your children in. And we are also going to be working with the school systems to be able to set up clinics, hopefully at the schools, to allow for vaccination to those that are eligible at the schools.
That's tremendous. Thank you so much. I mean, that is a real service to the town for people who need to access the vaccine. One other thing, the mandate through the state on masks, if you could update that for us, that would be great.
Yes, this is something that I know that we've all been waiting for. So the CDC on May 14th had changed their guidance, and Governor Baker, as of May 29th, he is updating the state's mandate as well. So as of May 29th, they are going to be changing the mask policy so that those that have been vaccinated, fully vaccinated, with 2 weeks since their vaccination, whether it's their second vaccination for 2-dose, or if it's the J&J vaccination 2 weeks after their single-dose vaccination, will no longer need to wear masks outdoors or in most indoor settings, and with some exceptions. So face coverings will still be mandatory for all individuals on public transportation systems, in healthcare, and in other settings hosting vulnerable populations, such as congregate care settings. And face coverings will also remain required indoors for staff and students of K through 12 schools and early education providers. So the emergency orders after May 20, after June 15th, the governor is going to be rescinding those emergency orders. But as of May 29th, the face mask policies are going to be updated so that fully vaccinated people will not need to wear those masks, as I just stated, outside and indoors for most situations.
So for our particular congregate places in Kingston, the Council on Aging, the rec center, the library, the stores, people can go in them as of May 29th without a mask on.
That is correct. So the council, yes. So they have it so that congregate care settings are going to be, are identified as settings such as, well, they're going to be assisted livings type of settings,
Nursing homes, right?
nursing homes, jails, things like that.
Right.
So those are congregate care, but remember, we have situations where we're still going to have to work around highly susceptible populations. Businesses have the option, if they feel that for the protection of their staff, that they want to keep face mask policies, they're allowed to do so.
Okay.
So that's something, and if people feel that they want to continue to wear the masks because they feel more comfortable, they feel that they aren't certain as to their health status, that they feel like they may be more protected, they most certainly can do so as well.
Okay, thank you. You are doing a tremendous job helping to protect the town during this fluid situation and dealing with the pandemic and keeping everyone safe. So a lot of good information today to share with everyone. So I hope you all have a good holiday weekend. And again, thank you to our veterans for all you have done and for your service. And take care and be safe.